Thank you for joining me on News Pulse. I'm Akivito. Nagaland has one of the highest numbers of people suffering from HIV/AIDS, and on top of that, the world still has not found a cure for HIV/AIDS. There are preventive measures and treatments, but no definite cure. Dr. Hotoka, a senior medical officer, told Hornbill TV that Nagaland is the second highest state in India with people affected with HIV/AIDS, and that Nagaland reports new HIV/AIDS cases on a daily basis. Hornbill TV also visited the antiretroviral treatment plus center, District Hospital Dimapur, to find out the grim reality. And now let's have a look at the report of our reporter Adona.
HIV, unfortunately, is very much in our community, and what data we have, how many patients are suffering with HIV, I would say it's just a tip of iceberg. So if we see the data, then today, as per National AIDS Control Organization, our Nagaland stands at second highest HIV affected state, HIV prevalent state in India, second highest. And when it comes to Nagaland, if we break up into different districts, because each district has a burden of HIV in Nagaland, and Dimapur has the highest amount of HIV patients. Also because it is the metropolitan city of Nagaland, and many patients, when they are sick, they come from different parts of Nagaland, as well as they come from the neighboring state of Assam. So Dimapur carries a huge burden of HIV when it comes to the status of HIV in Nagaland. So the percentage of Nagaland at the moment of HIV prevalence is, the adult prevalence is 1.65, which is considered very high compared to the national prevalence rate of HIV. And even in the last 2 years during this COVID pandemic, in spite of COVID pandemic, HIV, in a way I would say, it is on the rise.
So sir, rehabilitation centers can be ase, so how effectively do rehabilitation centers can do HIV/AIDS patients can coordinate kurina service di ase?
See, other than the rehabilitation center or other NGOs, the one who are closely working with us, even say considering this last 2 years of pandemic during the lockdown, our staff, including our partner NGOs like Vihan, ITEC, Ahana, YRG, they are our extended arms, and they put their effort to take the medicine and take it to the patients.
So do you think rehabilitation centers can be aro bisi takhiyo lagina na kinika ase situation isate?
Yeah, if we see the demand or the burden of HIV in Nagaland, definitely more NGOs should come up. We hardly see any well-performing NGOs. If we consider the HIV-affected orphans, HIV-affected children, just for that matter, for their education, or even the livelihood, the skill development. Our patients, many are unemployed, and they need to earn so that they continue to provide for themselves, for their family. So I believe there's a scope to provide help through different activities towards the people living with HIV/AIDS.
So sir, itu LFA ko inabi ase poila itu takise koise holibi itia discontinue hoise to what do you think about that?
LFA, which stands for Legislators Forum on HIV/AIDS, it was a very noble project by our legislators. They initiated this for the first time among all the legislators. So Nagaland, everybody appreciated the effort that they put, that each MLA contribute for their community towards people living with HIV, towards creating the awareness, towards creating the reduction of HIV/AIDS stigma and discrimination. So LFA played a very big role of helping, because everything needs financial help when it comes to creating awareness. So for many years there was a big help, and I also participated in few of the awareness campaigns, and it was very fruitful. But unfortunately, the government has given up this funding towards this LFA. So I believe this should be revived. I believe it will surely help towards creating awareness, because we still need the help of our legislators. It may be a little amount, but it definitely has made a change in creating and in improving the status of HIV/AIDS in Nagaland. But since we are still at the battleground, the battle is not over. So how can they just stop? I believe we need them so much. We need their help. So this is my humble request to the current legislators, if they could think over it and revive this LFA. My only advice is, if there is any risk history, any behavior that you think that you could be having HIV, then you should come up for testing. Because if you don't test, you may feel you're normal, you're healthy, but you could be carrying the virus if you had a high risk behavior. So please come forward, please send your dear and near ones, please send your friends and come for testing. For HIV patients, every facility is available in District Hospital Dimapur, ART Plus Center.